Now we're going to be moving on to Katie Griffiths, who is the head of communications at the Institute of Osteopathy.
So thank you very much for inviting us to come and speak to you on this whistle stop tour. I'm going to talk to you today about osteopathy. I was a practicing osteopath. I've just recently gone full-time working for the Institute, which is the professional body representing osteopaths. We represent around 70% of registered osteopaths and students in the UK. I formerly worked both in private practice and in an NHS secondary care unit. So I have seen sort of both sides of both working within public health services, but also working outside in the private healthcare service with multidisciplinary teams. So just moving on, so who are osteopaths? We are regulated healthcare professionals. We have also been regulated since 1993, and we are primary healthcare professionals. So similarly, we are able to examine and diagnose a range of diagnostic treatment, diagnosis conditions, and provide a range of package of care to support patients through a range of different issues. Our focus as osteopaths is also looking at the musculoskeletal system, but more importantly, how it interacts with all the other systems of the body to maintain optimal health. So we very much take a whole person approach to health. And when we say whole person, we're talking about both the body, but also lifestyle, mental health, the whole package, and look at each person as an individual. And our treatment and our care is very much tailored to the individual. We work closely with other healthcare professionals, both in private practice and in the public health service. We do work in multidisciplinary teams with other healthcare experts. That might be consultants, other AHPs, or we might also refer in where it is beyond our scope of practice to be able to fully support that patient individually. In terms of the patient populations that we are able to support, everything from cradle to grave. There is a minimum standard required upon qualification to work as a primary healthcare practitioner across the piece, but we also support postgraduate education in various specifics in patient populations, particularly in the paediatric world, where obviously the knowledge is much more specialised and required, but also both in sports, in elder care, later life, women's health, and other areas. So we have the full range within that. We do predominantly work in private practice. I think around 95% of osteopaths are still in private practice, but we'll work collaboratively with local healthcare professionals. We are available with the NHS, but generally we're working in multidisciplinary teams in secondary MSK units. So what you'll find happens is that if patients do go via the traditional NHS route, they may be referred to a musculoskeletal department, in which they may be seen by both an osteopath, a physio, or other healthcare professionals, providing a whole range of care for that individual patient. So what else? So as he mentioned, our regulator is the General Osteopathic Council. So you cannot operate in the UK unless you are registered with the council. We're regulated by law, and that really protects patients to ensure that you're seeing the appropriately trained and registered healthcare professional. We are recognised as one of the 14 allied health professionals by NHS England, so that includes the family of podiatrists, physios, paramedics. So we're encompassed within that group of healthcare professionals recognised by NHS England. In terms of our training, it's a minimum of 4 years at M level, at master's level, and that's to get us to that primary healthcare element. We are required to take quite rigorous continuous professional development throughout our careers, so we have to continue to keep up to date with the latest evidence and research year on year. And as I mentioned, there are also postgraduate areas where osteopaths may choose to specialise in certain patient populations. As I say, we're well known for the sort of muscles, joints, ligaments of the body from head to toe. So we'll focus on all of those. But as I say, where we're coming from is how that interacts with general health, whether it be through the other systems of the body and how that affects general well-being. And we're really looking at that whole package and creating a unique treatment protocol for each patient that we see. And as I say, we obviously naturally work very closely with others. GPs often do refer out into private practice where particularly they have a good relationship with the area, and we know that we can see patients much quicker than certainly some of the challenges that we've got with our public health services at the moment. We have osteopaths that are working very closely with midwives and other paediatric type services in local communities. And as I say, we also might be quite commonly work with physios and podiatrists. It's very common to see osteopaths working within that sort of multidisciplinary team, looking at the patient as the centre and bringing out all our different skills to ensure optimum health for that patient. So I did mention sort of cradle to grave, and there are various patient populations that I've also mentioned there. In terms of the adult population, they are the obvious. So we talk about sort of the amateur athletics, those are active, you know, if you go to the gym, etc. Those are people that are generally in good health, very invested in their health, but obviously, you know, they might be susceptible to injury, they may want to be improving performance, and that's certainly where we come in. While sometimes normally the initial pathway is through pain, what we also do heavily work on is prevention. So we'll keep the body into its optimum health that it can do for that individual. So while the initial entry point may often be because someone's coming to see us in pain, what we really want to do is keep them maintaining at the optimum health that they can. We've talked about children's and parents. That obviously does include both pre and postpartum health for women, and general other women's health issues. There's a lot of work that osteopaths do, specialised training in that area to support women's health. Workforce is an interesting one, and we did see a spike, interestingly, obviously, with the pandemic, and a lot of people retreating into an increasingly sedentary lifestyle, and the impact on health and mobility and those issues with ergonomics in the workspace, etc. So again, we can provide advice, ergonomic assessment, looking at both treatment, health advice, rehab exercises, as I say, the package of care that can ensure that people are able to maintain and keep healthy at work. That also obviously goes to those that maybe have more physical and demanding jobs. I mean, you know, sounds stereotypical, but you know, many of my patients were in the trades. They understood the importance of keeping themselves fit and healthy, and used to come and see us not only to deal with any pain issues, but to ensure that their mobility and physical health was as best as it could be. And of course, we've got those with those specific MSK conditions. Now, many MSK conditions are, you know, they're not curable, they're not treatable per se, but what we can do is help and make sure that we can minimize pain and management options for people so that they can live better quality of lives with those conditions. So whether that's arthritic because you're getting slightly older, potentially even some of the inflammatory arthritis where obviously that's autoimmune, so there's nothing we can do to change that, but we do know, and there's evidence that gentle massage, gentle manipulation and mobilization can very much keep mobility and manage people through those difficult points. And then of course there's the traditional back pain, neck pain, you know, tennis elbow, runner's knee, all those sorts of MSK conditions that people may come across. So just some statistics here, which I won't go through in detail, but I think they really go to both the patient experience, which is really important. You know, how do they feel when they come to see an osteopath? And we have really high advocacy rate from osteopathic patients. We have a national database called Patient Reported Outcomes, where patients are asked to report their outcomes and experience of osteopathic care anonymously through a national clinical database, so that we can gather robust data on the effectiveness of osteopathic care and practice. Patient satisfaction is consistently high, as you can see, and also what we do see is obviously very much dependent in terms of what the presenting issues are, but patients are, you know, reporting high changes and improvements, not only at 1 week post-treatment, but into 6 weeks post-treatment as well. As I say, these are robust, validated data points, independently brought together through our research arm. There is an interesting statistic I thought was interesting, particularly for this audience, around the effectiveness in reducing loss of work days, through which we know the secondary highest cause for loss of work days is MSK issues. And we've also got data to support the benefits of osteopathic care in trying to reduce that. All these studies are available through the Institute's website and are published in our Quality in Osteopathic Practice report. The other statistic I wanted to show you, which again I think is quite interesting, while we are a very small profession compared to a lot of the larger professions, so knowledge and awareness is limited compared to obviously your GPs and physios, etc. What we do know is that once patients do come to see an osteopath and they've engaged with the osteopath and understand the expertise and the skills that we have, there's a huge amount of confidence in the expertise, the care and the knowledge of the osteopath as a healthcare professional by the patient base, and you can see that clearly on this graph, where you see with osteopathic patients, once they've seen it, they have a very high level of confidence in the advice and care that their osteopath can provide. In terms of case studies, there are a number, but I've chosen to pick this one because I think it goes to really the osteopath's ability to make a full examination and a triage perspective, so able to understand if it is an MSK issue, if there are underlying issues that may need further specialist care from outside referrals or consultants, or referral back in to public health. So this is a study where osteopaths were working as first contact practitioners in GP surgeries, so they would be the first contact rather than going to the GP, where patients that were presenting with various aches and pains that thought were MSK would go to an osteopath for triage, examination and diagnosis. And there's some really interesting statistics here about the role of the osteopath in that role, and being able to diagnose and signpost to appropriate the onward intervention, or even provide the relevant health advice so that patients can self-manage. Again, these are all published in the public domain and available for the Institute's website. I think for me as an osteopath, even though I'm not quite in practice anymore, beyond the stats and beyond all the regulation and the training, we're a really passionate profession. We're passionate about people's health. And you'll see that from just some of the testimonials here. These are all osteopaths that I've worked with. You can see we have a range of ages and backgrounds and professions, but the core of what an osteopath is we want to make people feel better. We would like to improve their quality of life. We want to make them as mobile as they can. Just because you're 60 or 70, you know, do you want to still work in your garden, do your garden, lift your grandchildren up? That's what we want to find for our patients. What is it that's going to help them help their lives, help their quality of lives, and how can we support them through that? I've got some contact details here, both of ourselves at the Institute of Osteopathy, National Council for Osteopathic Research, and of course our regulator, who ensures the standards of osteopathic practice here in the UK. We've also got some research from reports, and there's some specific research and reports for any of you that are healthcare professionals who are looking for a little bit more data and evidence on osteopathic care, and that's all there. So just on that note, I'd just like to thank you all. As I say, we're Institute of Osteopathy, and thank you for your time, and I'm happy to take any questions.
Katie, thank you very much for that. So one question is, can you, in your opinion, tell us the difference between osteopathy and the other manual therapies such as physiotherapy and chiropractic?
I mean, obviously, I cannot talk on behalf of the chiropractors and physios. I think from our perspective, as I say, I think we have a range of interventions which we mix and match. So we might use some rehabilitation such as physios. We might use some adjustments as the chiros. We will use mobilization, soft tissue. I think the osteopath's viewpoint is we have a toolkit of interventions, but it's finding the right interventions for the individual rather than having one toolbox. We have a toolbox with a number of interventions. I think also we're very much, as I say, looking at the whole person approach, and we don't have what I call that cookie cutter approach to care. So often it's very easy to sort of say, yes, there's a protocol for this condition and you do X, Y, Z, but we really want to get to know the individual and make sure that that package of care is suitable, because some people, one may not want to be able to do rehabilitative exercises. Some may not be able to, or not, maybe adjustments aren't ready for them. Some may want just health advice. So it's really understanding the patient, understanding where they want to get to, and really providing different options for them in terms of that package of care.
That's great, thank you. It's all about providing that personalised support. So we've got another question there. Are there any patients' demographics or health conditions that may not be suitable?
I mean, obviously, within our scope of MSK focused, I mean, obviously, we do not claim to be specialists in everything. I think where we would be able to definitely support are generally those areas where there is an underlying MSK, musculoskeletal component. As I say, obviously, if you are, for example, got a diagnosis with a rheumatoid or inflammatory arthritis, obviously you would be looking to your rheumatologist to lead on that, but we would be working with that rheumatologist to help. So as I say, we're certainly not claiming to be specialists in everything, but I think what we can bring to the party is because of the level of our training, is we're able to identify very quickly what's out of scope of what's suitable for osteopathic care.
Thank you.
Thank you very much, Katie.